So when you reach your 30s, you've already had approximately 10 years of loss of collagen. Collagen is the main protein within your skin, it takes up 75% of the protein within your skin. I've talked about this before. It's a really fibrous protein. And what it does is it acts like a scaffolding to your skin. So when the collagen starts to break down, you lose that sort of ability for your skin to hold itself up, and it will start to sag, start to create some little wrinkles, start to create some fine lines. So collagen starts to degenerate, if you like, and the renewal process slows down. So that starts happening as soon as you reach adulthood. So in your 20s that starts. Obviously you don't notice those signs in your 20s, and the stuff that helps to break down the collagen will be UV rays, particularly UVA. And also the environment, depends what sort of diet you're having, depends what lifestyle you're living. Lots of things we can talk about, but I won't go into it all right now. So really once you reach your 30s, you will have lost potentially 10% of the collagen that you started out with in your youth. Now with collagen comes elastin, it comes hydration. So you want to protect that collagen for as long as possible. Best way to protect it, obviously, protect from the sun with your SPF. Minimum 30, best to protect with 50 all year round, and use something else to give yourself that sort of sun-kissed look. Use makeup, or use a fake tan, for example, if it's really important to you to have a bit of colour. Again, as in your 20s, you should be enjoying a really good skincare regime. So you should be cleansing twice a day, in the morning, in the evening, removing all your makeup. And you can do that. There's some lovely products around now. We've got this lovely non-comedogenic cleanser, which won't block up any pores if you're prone to blemishes. We've also got the lovely Snow O2, which if you've been into the clinic and had facials, this tends to be what we use. This is one that fizzes up with oxygen bubbles. And a toner, or a booster as this one is known as, will just help to rebalance the pH of your skin. Skin is quite acidic. It's a sort of about a 4.5 on the pH scale. And so it's really important for your skin to have that pH balance, or else the barrier starts to become compromised. And that's when you'll get blemishes. That's when you'll also get breakdown of your collagen and degeneration of your skin. So by now you might well be enjoying your skincare regime, let's hope so. And you might want to add in some serum or just something a little bit extra prior to putting your moisturizer on. And this is an anti-wrinkle serum that we've got. It's not too soon to start using that sort of thing. Best to prevent, don't forget that. You can help to prevent wrinkles and fine lines if you start using really good serums early on in your 30s. And then you can still be using your favorite moisturizer. It might not necessarily be this one, but it is my favorite. An antioxidant, good to introduce vitamin C, niacinamide, anything like that, but it's all in here if you want to keep it nice and simple. And on top of all that, you will put your SPF, followed by your makeup in the daytime if you so wish. So clinic treatments, once again, can't recommend the glycolic 40% peels enough. They're just really nice for helping to keep those dead skin cells from the surface of your skin. Gives you a lovely, smooth, clean canvas really to work with. Also microneedling, but for a little bit of collagen induction, microneedling, a couple of times a year even, would be a really good addition to your skincare regime. So you may be starting to develop a few sort of the other signs of aging. It's unlikely, but it depends how well you've looked after your skin. And some people just have that sort of family tendency to develop sort of red vessels, blushing cheeks from sort of excessive capillaries on the surface of your skin. So IPL is a really good addition to your skin regime, if you like, to have as an in-clinic treatment. And that will help to reduce that redness, but it will also rejuvenate your skin. It will convince your skin that you've had some sort of a trauma from heat, and that's when the collagen renewal takes place. So to summarise then, in your 30s, you will be continuing with your lovely skincare regime. You'll be cleansing. You might be adding in a serum at this stage for sort of anti-wrinkle. Continue with your moisturiser and obviously your SPF. Clinic treatments, glycolics, always good, and microneedling, plus or minus IPL if you're starting to suffer with a little bit of redness, rosacea, or even sort of the odd thread vein.